Chapter 20, Pharmacology. Medications to review. A sound understanding of pharmacology is essential for nurses. This will ensure minimal errors. Nurses are expected to administer the correct medications to the right patients, or teach the patient or their caregivers proper administration techniques. Proper knowledge of pharmacology will enable them to correctly assess patients. This knowledge greatly contributes to the minimal errors that nurses commit. Drug-drug interactions. Despite their importance, drug-drug interactions are often overlooked by nurses. According to a survey, 40% of nurses reported observing a drug interaction in their clinical practice in the past year. Although many nurses were aware of potential drug interactions, few explored them in depth. Many nurses use alternative resources to identify possible drug-drug interactions, such as handbooks and colleagues. In addition, few nurses have access to clinical pharmacists or computer programs to identify potential drug-drug interactions. The number of drugs on the market makes drug therapy complex, and the possibility of drug-drug interactions increases every day. Nurses must be aware of these interactions, as they can influence the patient's response to a given drug. Because of this, good communication among healthcare team members is critical. Patients with chronic conditions and those taking multiple medications are at greatest risk for drug interactions. Older adults are particularly susceptible to drug-drug interactions. About 75% of older adults take at least 2 prescription medications, in addition to a variety of OTC drugs. Although it is crucial to be aware of drug-drug interactions, a yellow card is the easiest and most obvious way to report these. Most prescribers use the yellow card. However, the Committee on Safety of Medicines received no reports of a drug-drug interaction with fluoxetine, chlorpromazine, risperidone, or lisinopril. Clearly, there is a need for increased public awareness of drug-drug interactions, and to encourage trusts to incorporate reporting into their drug policies. There are several ways to mitigate these risks. For example, prescribing guidelines should be followed to avoid negative drug interactions. The researchers recommend titrating drug doses and switching to an alternative drug whose metabolism pathway is different. In addition, nurses should monitor the interactions of their patient's current medication regimen. Hopefully, these guidelines will help them make informed decisions when it comes to addressing these issues. They may even help nurses identify a new medication that is not currently available. One of the most important aspects of identifying in treating drug-drug interactions is to ensure adequate surveillance. This means that nurses have the ability to avoid potentially dangerous drug combinations. Furthermore, adequate surveillance systems will allow them to prevent clinical problems. Additionally, prescribing indicators should focus on identifying potential DDIs and alternative treatment options. That way, nurses will have the best knowledge to determine when a drug-drug interaction may occur. Another important way to prevent negative drug interactions is to keep track of the dosages and types of drugs in the patient's medication. Over-the-counter and prescription drugs often have warning labels. However, these warnings do not contain all warnings and should not be relied upon as a substitute for careful consultation with the physician. Moreover, they should always discuss the drug with their patients before prescribing any medication. Grouping drugs into classes. In nursing, you must know how to classify drugs. Drugs are classified based on their effect on specific body systems and their potential for misuse. This is known as pharmacology. Pharmacology also classes drugs based on their schedules. The control of drug use in the 1960s led to the creation of 5 schedules for drugs. These schedules were intended to make prescribing and monitoring medications easier. To better understand drug effects, you must understand the dose of a given drug. As a nurse, you must pay close attention to the anticipated effect as well as to the response of the patient. You must also be aware of the overall dose-response relationship and how to adjust the dose to get the best response. Each drug has a peak, duration, and onset of action. These characteristics are affected by the route of administration, GI tract capacity, and the patency of the circulatory system. A drug's peak concentration is usually where it produces the greatest therapeutic effect. To increase the level of engagement in pharmacology classes, faculty can incorporate social media into the teaching process. Students can interact with faculty members through videos, web-based quizzes, or blogs. These strategies promote student engagement while increasing retention. Moreover, they also help improve student understanding of the material. Ultimately, social media integration is vital for nursing students' success in pharmacology. Despite the fact that pharmacology courses are important for nursing students, Many universities and colleges are striving to improve the quality of teaching in the field. Students are increasingly demanding and expect support during their studies. Thus, educators have devised a variety of learning strategies to help nursing students understand the complexities of the subject. A pharmacology course can make or break a nursing student's career, so it is essential to provide adequate pharmacology instruction in order to meet this goal. Students who take pharmacology courses are expected to learn complicated concepts through interactive online learning and face-to-face classroom interaction. These strategies can help students engage with the course content and help them master difficult pharmacological concepts. However, they can also enhance their performance in online or classroom assessments. So, if you're a nurse who teaches online, consider using innovative teaching methods to increase the level of student engagement in your pharmacology course. In addition to combining traditional and digital learning methods, game-based learning has proven to be highly effective. Kahoot allows instructors to create multiple-choice questions that students can answer in small groups. These tests provide immediate feedback and create friendly competition among students. In addition to gamified learning methods, Kahoot is an excellent tool for nursing students to enhance their knowledge of pharmacology. Medications to review. Below is a list of just some of classification of medications to review. Adrenergics, adrenocortical steroids, analgesics, antacids, adsorbents, antiflatulents, anti-anginal, anti-arthritic, anti-gout, antiarrhythmics, antibiotics, anticholinergics, anticoagulants, anticonvulsants, antidepressants, anti-diabetic orals, anti-diabetic insulins, antihistamines, antilipidemics, antihypertensives, antiparkinson, antiplatelets, antipyretics, cardiac glucosides, cholinergics, diuretics, electrolyte replenishers, laxatives, muscle relaxants, ophthalmics, sedatives, anti-anxiety, spasmolytics, bronchodilators, GI tract drugs, major tranquilizers, vasodilators, anticonvulsants, antidiarrheal, antiemetic, antifungal, antipsychotic, antiviral, arthritis meds, BPH meds, cough meds, decongestants, expectorants, antitussives, GERD meds, memory enhancers, neurogenic bladder meds, neuropathic meds, restless leg syndrome NDS, skin barriers, thyroid meds, topical antifungals, topical antibacterials, topical antiparasitics, topical antiviral, topical corticosteroids, and of course review vitamins and minerals and nutritional supplements. It is also important to be familiar with complementary and alternative therapies. While not exhaustive, this list provides a brief overview of the common classification of medications you will see in home health. Tip: see Medscape.com for a further detailed database of medications for you to review. Understanding pharmacodynamics. Pharmacology is an important subject for nurses, as it determines how well drugs work in the body. Pharmacodynamics is the study of the biochemical changes that occur in the body as a result of drug concentration. It also involves the post-receptor effects of drugs. In order for nurses to be effective in their practice, they must understand the processes of drug absorption and metabolism. The following article will explain these processes in more detail. The term pharmacodynamics describes the actions of a drug in the body. Specifically, it relates to how long a drug takes to work. The duration and extent of a drug's effect is measured in terms of Emax. This is the maximum effect of the drug on a parameter, such as platelet inhibition in an ex vivo test or the greatest lowering of blood pressure. When it comes to administering medications, the role of a nurse is to monitor the condition of patients, communicate with physicians, and give them medications. To do this successfully, nurses must understand pharmacodynamics, pharmacokinetics, and the physiological interactions of drugs. Fortunately, a Bradley Online Doctor of Nursing Practice Family Nurse Practitioner program can equip you with the knowledge and skills necessary to successfully handle pharmacology in the patient. The material on understanding pharmacodynamics for nurses is a comprehensive study that will help nurses and other healthcare professionals learn how to safely administer drugs. Upon completion, the course credits 6 contact hours for the online independent study activity. It provides essential knowledge of drug pharmacokinetics and pharmacodynamics and their applications. Using pharmacological knowledge will be an invaluable tool to help nurses manage patients in the long run. Understanding the process of drug absorption and dissolution helps nursing professionals make better decisions when prescribing medications. The process of monitoring drug levels includes peak and trough levels. Peak levels are the highest concentrations, while trough levels are the lowest. Keeping track of these drug levels is important to prevent overdose and underdose. High peak levels can cause toxicity, and low trough levels can mitigate an intended effect. Pharmacokinetics outlines the actions of drugs in the body. Excessive medication can cause serious adverse effects. Toxic medications can cause organ, system, or even fatal effects. When the body is unable to eliminate or metabolize a drug, it builds up in the blood and is thus considered toxic. These side effects are often unexpected and can result in dangerous interactions or even fatal outcomes. Understanding pharmacodynamics for nurses helps nurses understand how drugs work and how to avoid them.